This is a KX News special report.
Good afternoon, and welcome to this afternoon's news conference on COVID-19. Our teams have been working around the clock from all different areas of both government and also nonprofit world and the community on this issue. So we just thank you for being here and thank you for taking an interest. So before we get started, I just want to introduce the panel that's up here before you, and then also introduce some special guests in the crowd. Introduce yourself. And what? Introduce yourself. I apologize. Nicole Pesky, Chief Communications Officer for the North Dakota Department of Health. So thank you. Thanks for thinking that matters. That's nice.
Thanks for all the great work you're doing, too.
Thank you. So the panel that we have up here, Governor Doug Burgum, Lieutenant Governor Brent Sanford. We have State Health Officer Mylyn Tufte. We have Dr. Joan Connell. We have Pamela Sagnes with the North Dakota Department of Human Services. We have Superintendent Kirsten Basler from the North Dakota Public Instruction, Michelle Comer with the North Dakota Department of Commerce. We also have some individuals in the audience that we've asked to be here as well and are able to field questions that are from a variety of agencies that are impacted by COVID-19. These include Eric Spencer with the Greater North Dakota Chamber, Tim Blazel with the North Dakota Hospital Association, Courtney Coble with the North Dakota Medical Association, Shelley Peterson with the North Dakota Long-Term Care Association, Terry Trainer with the Association of Counties, Scott Davis with North Dakota Indian Affairs Commissioner, and we also want to just mention Blake Crosby with the North Dakota League of Cities, who has decided to be responsible and is ill and decided to stay at home. So we just thank you all again for being here. All right, so how we're going to do this is we'll just, if you could hold your comments to the end, we're going to give these folks up here some time to give their remarks, and then we'll take some questions at the end, as well as we have a call line open too for our media across the state. So thank you again for being here. Governor Burgum.
Thanks, Danelle. Again, thanks everybody for being here today. Gratitude for all the professional press and media here. Thanks for all the people that are listening in. Thanks for everybody that's helping us get accurate information out to the citizens of North Dakota as we focus on facts, not fear. Today, we have an announcement, which is the Department of Health confirmed 2 additional cases of the novel coronavirus disease, also known as COVID-19. These 2 new cases are of particular interest because they're our first 2 cases of community spread. Both of those individuals are residents of Morton County. This brings our total to 7 confirmed cases. And as of this press conference, there were 367 tests that were completed. As we learn new terms, community spread means that the spread of an illness for which the source of infection is unknown. The previous 5 cases were travel related, meaning that the individual who tested positive, we were able to identify that they had traveled and came in contact with someone who also had tested positive. The individuals who tested positive for Morton County are both women, one in her 20s, the other in the age range of 10 to 19. They are not hospitalized. They are self-isolating at home. In Morton County cases, the patients had no travel history and no contact with other persons who had been confirmed to have had COVID-19. The health department is working to identify through the work that they do professionally during an epidemic like this called contact tracing. They're working to identify other individuals who may have come into recent close contact with the 2 new cases. If they find people who have come into recent close contact, they will contact, the Department of Health will contact those individuals and ask them to be self-monitoring for fever and respiratory systems as we try to contain the spread of COVID-19. Just a note on privacy. This is the standard we're following, which is age, gender, county, whether they're travel or community spread. That's what we're sticking to protect the privacy of these individuals. And again, because these are the first confirmed cases of community transmission in North Dakota, it reinforces the importance of all North Dakotans to practice social distancing and stay home when you're sick, even if it's minor. We have been, and I'll go back to the top, that's sort of the news headline today. Let's go back to the top of our strategy. Our strategy that we have in North Dakota that we're trying to deploy is to save lives. That's what the objective we're trying to do. And we're trying to save lives by stopping the spread of a highly contagious virus, which has a higher mortality rate than the flu for people with underlying health conditions and people that are elderly. We've talked about more generically about protecting those people that are most vulnerable in our population. But for North Dakotans and those here today, I want to give a stronger definition of how big a percentage of that population that is, because in North Dakota, being the great place to live, great place to raise a family, it's a great place to also have a long lifespan. And we have in our state 116,000 individuals, over 15% of our population is age 65 or older. That includes 37,000 that are 65 to 69, 27,000 that are 70 to 74, 19,000 that are 75 to 79, 15,000 that are 80 to 84. And again, if you like longevity, North Dakota, good place to be. We have 18,000 people in our state who are age 85 or older. But the mortality rate for this disease escalates with age, and it also escalates with underlying respiratory disease or other chronic diseases like diabetes. In North Dakota, we have, as of a 2018 health survey, we have over 54,000 people in our state that have diabetes. And of those two, the majority of those are type 2. And we know that type 2 can be controlled by diet and exercise. And social distancing doesn't necessarily mean that we all have to become the most sedentary state in the nation, particularly when we know that this is not an airborne disease. So again, encourage people that you can achieve your goals of social distancing, being more than 6 feet away, and still go for a walk. You can walk the dog or walk with other family members that you may be isolating with, but get some fresh air, get out and get walking. But understand, when you take these are overlaps in these population, but let's just say that if we got 15% of the population is 65 and older, and just taking one disease category, diabetics, that we could end up with close to 20% of our state population actually would fit into the group that we're calling the most vulnerable North Dakotans. We're not talking about 5 or 10 or 500. We're talking about over 100,000 individuals that we're trying to protect. So when we ask people and we talk about individual responsibility, we're asking people to help protect the lives of the most vulnerable. We're talking about the folks that are in the 80% that are not vulnerable to make decisions about social distancing that will slow the spread of this, that will help protect and save the lives of those that are vulnerable. And again, we're going to have presenters up here today talk about it again, but a couple basic things. The most important one is, again, this idea, that we've had in our culture forever, North Dakota tough. I grew up with it. If you're not feeling well, too bad, tough luck, get out of bed, get to work, go put in a full day's work. That's what many of us grew up with. And we have to switch from North Dakota tough to North Dakota smart, and people have to stay home if they're sick. If they've been in contact with someone who's tested positive, they have to stay home. If your family member is tested positive, one of the greatest ways to reduce spread is you also stay home and self-isolate. So again, that's one of the strong ways to do that. We are also have to take a look at other things that we're doing. We have talked about avoiding social gatherings of more than 10 people. We know that lots of businesses have been very responsible, including trying to come up with working from home options for people. We've asked people to avoid discretionary travel and social visits. We've certainly tried to discourage visits of anybody to going to our skilled nursing centers that has any possible inkling that they may have any health issues or have been in contact with anybody, because we're very, very much trying to make sure that we keep the COVID-19 out of our 80 skilled nursing centers and other places where elders gather. We've been giving this guidance for several weeks and asking for individual responsibility. I think it was on strong display last night on social media. We've seen two different things. When you have something unknown or something that's fear, you have two responses. Humans have two responses. responses. One of those responses is panic, and that leads to empty shelves and panic buying. The other response is denial, and that leads to lots of people posting on social media about packed bars last night, people celebrating St. Patrick's Day. So we have, both ends of the bell curve going on in North Dakota. We want to get people to move to the middle. We want to get to that state of calm, and we want to have an away from either denial and cynicism or just pure panic. We want to get people to say, hey, we can be responsible, but that requires individual responsibility. That means everyone. But given that the guidance that we've given hasn't been working, we're taking some stronger guidance. And now that we have evidence of community spread, we always said this was going to be a trigger. We are strongly recommending that movie theaters, gyms, other similar types of business where the public congregate, that they consider closing or dramatically restricting the amount of contact that they might come up with. Bars and restaurants should consider closing or switching to food takeout or delivery options only, with strategies to protect the public themselves and their workers. And now again, we're not doing a mandatory closure. We're just strengthening the recommendations that we have. And of course, at the local level, you've got local mayors have the authority to step up and do even stronger stronger measures if they need to. But right now, we're just asking for business owners to make the smart decisions on how they do that. Now, people would say, hey, well, if you are, if you're closing a bar or restaurant, then why aren't you closing a manufacturing plant? Here's why it's different. A manufacturing plant in North Dakota, everybody that walks into that plant is an employee of that company. That company can set very strict rules about if you're sick, stay home. They can do screening at the entrance. They can say we're not taking any visitors, no more plant tours, no more school visits. They can control that environment because all those folks work for them. If you have someplace that's public, like a bar or a restaurant where the public can congregate, then we have to have a stronger set of recommendations that people go with alternative forms to do that. Now, people have said, what about, your rule of 10 people for social gatherings? 10 people get together in the size of a football field. That's not a problem. If 10 people get together in the size of a closet, that is a problem. And so, again, we want to make sure that that we're using common sense, because the basic rule of measure here is to try to make sure that you've got distance of more than 6 feet. And I know we're not quite achieving that on stage here, but that's where we want to try to get to. Thank you for all of you in the audience for sitting apart from each other. But again, we want people to make choices about protecting the public, themselves, and their workers. We'll be evaluating the potential for mandatory closures on a day-by-day basis if we think that either we see a broadening of community spread or if we see more cases of where we think that folks are not following the guidelines. We know that there's a lot of people in the faith-based organizations we have questions from. A lot of them have made decisions to stop either holding services online or stop having events, say, like Wednesday night gatherings or others. And again, we support those faith-based communities for, again, trying to make decisions as responsible business leaders, because we need leadership from everybody in every organization, faith-based, private sector, public sector, to make those kinds of decisions. One of the things that we've learned, we're on the calls with all the other NGA calls. I was on a call with all the governors in the nation today, and I would sum up this, which is for those states that are further ahead of us and have seen widespread community spread and a steep escalation in cases, they would say, if you think you're doing things early, you might be on time. If you think you're doing it on time, you're probably late. So if it feels to the public that some of the steps we're taking, whether it was school closures earlier in this week or what we're asking bars, restaurants, movie theaters, and gyms to do, it may seem early, but it likely is that it is on time. We hope that we're not too late. With that, I'm going to turn the podium over to Mylyn Tufte for an update, and we'll be back for some more topics at the closing and during Q&A. Mylyn?
Thank you, Governor. I wanted to express my gratitude to our healthcare partners that are here today, local public health, who's been tremendous in some of the work that we're doing at the local level, and of course our tribal health partners. So with that, I wanted to review some of the numbers, as the governor said, today we have 362 total tested with 355 negatives. And I wanted to let you know that we had made some changes on our website. We've modified that, how we track these numbers, and we had to remove some individuals who are tested in North Dakota but live in other states. This allows us to not double count these numbers. This also will help us with labs from other states as they are getting handled outside of the state. This only impacted negative tests and was just over 10 in number. Also today, we wanted to let you know we're working on recommendations on who should be prioritized for testing because of the shortage of swabs. These are the collection devices that are used by our healthcare providers. We will update you more at the news conference tomorrow on our testing criteria. Healthcare workers will receive guidance in the near future in the form of immediate advisory. This is a health alert advisory that goes out to our healthcare providers. Individuals from the North Dakota Department of Health long-term care consulting team has been traveling around the state, consulting with our long-term care facilities to do a walkthrough and assess and partner with these facilities on their infection control plan. There are 218 long-term care, basic care, assisted living facilities in the state. That's in total, and we expect to complete our visits by the end of the week. Just in closing, thank you, and wanted to reinforce our COVID-19 public health hotline. The hours increased, and that is daily, 7 to 10 p.m. at 1-866-207-2880. Individuals seeking medical advice should call their health care provider. And I wanted to introduce next Dr. Joan Connell, who is our field medical officer, and she's a pediatrician here locally. She is overqualified with the master's in public health, and she's also a pharmacist. So, Joan, thank you for your help.
All right, so that's a lot of information. So everybody just take a pause, and I want you to close your eyes, and I want you to ask yourself this question. What if I could actually save someone's life? Now, as you're thinking about that question, think about the feelings you're experiencing. Every time I think about that question, which is since I was about age 5 years old, I think of feeling powerful. I think of feeling strong. I think of feeling loving. I think of feeling selfless. Essentially, it makes me feel like a hero. People who are rigid about practicing social distancing are heroes. I next want to prove that point by talking about community spread in a little bit more detail. Governor Burgum, you did a great job. As Governor Burgum said, community spread is what happens when you can't trace the contact who got you sick. Many of us have experienced this when in the middle of flu season, let's say, you haven't been around anyone who's sick, but all of a sudden you wake up, you've got those body aches, you have a fever, your throat hurts, your nose is stuffy, and you think, oh, I've got it, I've got the flu. You don't know where you got it from, but you got it from someone in your community. Also, as Governor Burgum mentioned, the coronavirus 19 is more contagious than influenza. So that means people who are out in our community are potentially infected. They don't feel sick. They feel normal, and they're contagious. So when we talk about social distancing, that is the only way to prevent or slow down spread of coronavirus. You must stay at home, sick or well, unless there's a really important reason to leave the house. If you do have symptoms of coronavirus, and those symptoms might include upper respiratory symptoms, so runny nose, sore throat, cough, fever, They might include lower respiratory symptoms, fever, cough, which tends to be dry, and shortness of breath. And a few people also get diarrhea with this illness. You absolutely have to stay home. Now, if you think you need to be tested, call your provider, arrange for testing if you agree that it's the right thing to do, then go home. Stay home. That is where you belong until you get your test results. And if they come back negative, you're still sick. That's why you got tested in the first place. Stay home. Now, if there's any other questions or if there's any other comments, I'm happy to address them for you.
At the end.
Okay. So next, I would like to introduce Pam Sagness.
Good afternoon. My name is Pam Sagness, and I'm the Director of the Behavioral Health Division with the Department of Human Services, and I'm happy to be here today to provide an update from the perspective of the Department of Human Services. We have been working together to navigate the risks and concerns with COVID-19. Our desire is to minimize the risk for individuals we serve, but also for employees. The department is committed to delivering on its mission of serving people in need across the state of North Dakota. We are working diligently to make sure that our team, our partners, and our provider networks remain operational through this public health crisis. DHS service delivery locations will remain open and will continue to serve clients. This includes the Regional Human Service Centers, the North Dakota State Hospital in Jamestown, and the Life Skills and Transition Center in Grafton. These facilities will continue to provide medically necessary services and are screening for COVID-19 illness risk. They are monitoring and following the recommendations of the CDC and the Department of Health. The department is also working with counties or the human service zones across North Dakota to ensure both county and state employees have the ability to continue to serve community needs. The outbreak of COVID-19 can be stressful for community members, for families and employees. The department is offering resources to support North Dakotans' behavioral health needs. During this time, information has been added to the behavioral health website, which is www.behavioralhealth.nd.gov/COVID-19. We have resources around dealing with the stress and also being able to find contact if there are services needed. We have many lines, including a recovery talk program, which is a peer support phone line that's available 24 hours a day for individuals who may be dealing with the stress of an addiction, recovery, but also the need to deal with the current situation. We also would recommend individuals to contact 211 if they're needing to connect to resources. And lastly, we've also added resources for parents and communicating with children. We're hearing a lot of need for support for children and families right now, especially considering the closure of the schools. We have resources online at parentslead.org that are specific for age and provide information on how to talk with toddlers all the way through teenagers about addressing the COVID-19 situation and how we can maintain routines and different examples for our children. The department is also providing additional information on our website, nd.gov/DHS, for providers and for partners relating to our work. We understand how important it is for people most affected by this instability during this public health crisis to have access to resources. We are continuing to look at opportunities to provide additional outreach efforts related to the needs and to better support people. The department is committed to reducing barriers also whenever possible. We've been working with the governor's office and our federal partners to pursue waivers, amendments, policy clarifications, and other changes to hopefully remove barriers that will increase access to behavioral health services. Thank you.
Good afternoon, everyone. Kirsten Basler, State Superintendent, North Dakota Department of Public Instruction.
Since the beginning of this week, the North Dakota Department of Public Instruction has been working in collaboration with our partners, the Governor's Office, the Department of Health, Department of Emergency Services, and very grateful to that collaborative nature that North Dakota has learned to and has historically worked as one. Thank you to the Governor's Office for the leadership on that. During this past week, during our school's closure, our end state goal at the Department of Public Instruction is to bring educational services back to normal. That's what we all desire. And although we do not know when that normal will be again, to that end, we are providing school districts with the guidance that is informed by data to help them make decisions that will allow our students to continue to learn throughout this process while ensuring that all of our North Dakota citizens are safe and well. Sunday night, schools across the state were given 2 objectives to accomplish during this time, this week. They were to develop a plan to reopen safely on Monday if the conditions warranted that, and they were also asked to develop a plan for extended closures. Leaders and staff across the state have been working on these 2 plans diligently. And the department has worked collaboratively, as I mentioned, with many agencies and stakeholders to develop a process toolkit that provides guidance on these plans and procedures. We have also developed resources and guidance on online learning and virtual instructions. Currently, there is no authority in North Dakota law that will allow online or virtual instruction to replace traditional classroom instruction time. This concept was introduced by the 2019 legislature, but it was defeated. Governor Burgum is currently researching this issue for a possible executive order. 2 other issues of paramount importance have risen to the top that needed guidance from the department. One of those is school meals, the continuity of food and nutrition for our young people across the state, and the issue of meeting the needs of our special education students. Our special education office is making it a priority to answer questions from the field as they come in. And leaders from across the nation, state superintendents, secretaries of education, are working together with the U.S. Office of Special Education to gather more specific guidance and processes that will address these important needs during this time. Currently, the Department of Public Instruction has received a waiver from USDA to allow North Dakota schools to begin immediately the summer food distribution program to meet these unanticipated closures across the state. Through these programs, food will be able to be distributed at more than over 160 of our school sites. Unfortunately, as we look to these 160 school sites and add in the districts that may also qualify to be food distribution sites caused by the census eligibility criteria, that leaves more than half of our schools without the authority to be school distribution sites for summer food programming. We are closely watching and advocating for the passage of H.R. 6201, which is the first Coronavirus Response Act. I visited with representatives from all 3 of our federal delegates last night, and they fully support this. It is currently being decided in the Senate, having previously passed the House. In the meantime, many districts have reported that they are already distributing meals or plan to begin distribution soon. I want to end on something that Dr. Connell mentioned, empowering people to make a difference. On Friday, I have a conference call with my family cabinet. This afternoon, I met remotely with my superintendent's student cabinet. And I have to tell you that I'm inspired by them. They shared with us that they felt fear, but they felt a need for common sense. They wanted more facts, more information. They asked for this from their superintendents. They asked for this from their school leaders. And at the end of the call, that group of young people had a plan to mobilize themselves and create a vehicle for them to communicate on their favorite app receiving information from the Department of Public Instruction based on fact that we were getting out to our school leaders, and they have made it their mission to communicate to their peers, the millennials of this generation, to make sure that they were doing their part to save a life. That cabinet committed to meeting with me on a weekly basis to continue to receive information, gather and coordinate their efforts to help in this fight, and they will be in constant communication with staff at the department to make sure that they are getting the most accurate and up-to-date information about where we are in North Dakota and the role that they can play in communication. Thank you. With that, I am introducing Michelle Comer about economic resources.
Good afternoon. My name is Michelle Comer, and I am the Commerce Commissioner for the state of North Dakota. I want you to know that everything I share with you today will be online in a consolidated website for employer resources by tomorrow, including additional support for everything I share today. There is information developing real time. We have also partnered with GNDC. I thank Eric Spencer, who's sitting here today, as we are hosting together an employer call tomorrow at 11 o'clock. I can provide you additional details about that as well today, and we will include any new details as they develop. At the Department of Commerce, our mission is to create and expand and retain wealth in our state. This mission has taken on new meaning considering this unprecedented public health matter, and we have redirected our resources to assist businesses during this time. The Commerce Department has taken the lead in coordinating resources to support business to mitigate and manage the economic impact to our state. These efforts include, but are not limited to, coordinating an effort across all state agencies and partner organizations to be able to provide you important resources and information as quickly and as clearly as possible. We have assigned researchers to understand draft federal legislation, so we were prepared to act when it is available. And I'm referring to the Families First Coronavirus Response Act. We are identifying and redirecting financial resources to support you, including working with the Bank of North Dakota and the Small Business Administration to access the Small Business Administration's Disaster Recovery Loan Program, as well as redirecting other state financing mechanisms to support business at this time. I will cover those a little bit today. And finally, we are assembling employer resources relating to COVID-19 in an easy-to-access, easy-to-understand web page on nd.gov. Our target availability for that is tomorrow. As mentioned, the state agencies and partner organizations that serve employers are banding together to support North Dakota businesses. We are working collaboratively with state agencies like the Department of Insurance, Tax, Secretary of State, the Bank of North Dakota, Job Service North Dakota, Worker Safety Insurance, Labor and Human Rights, and the Ag Department, as well as partner organizations like GNDC, chambers, and economic development organizations to share information as quickly as we can with our employers. This sets us apart from other states. Many of those leaders are here today or listening, and we thank you for that collaboration. Right now, I want to talk a little bit about available resources, and again, I will be able to provide more information online and in questions. But first of all, we are encouraged by our colleagues at the Bank of North Dakota to advise our businesses that anticipate stress and strain to start with their local bank. Your local bank is the most knowledgeable about your situation and how they may be able to assist you. Beyond that, the Small Business Administration has made available $7 billion to small businesses that anticipate stress during this time. On March 12th, the SBA announced this funding up to $2 million per business in disaster assistance loans. I want to emphasize that these loans are first come, first serve. Governor Burgum has already submitted the necessary declaration to the Small Business Administration, and we expect applications to be available within 24 to 48 hours. These loans can be used for working capital, operating expenses, and so forth. And again, I want to emphasize that we are going to be making the application resources available to businesses as soon as this evening. It's first come, first serve. Those that apply first will experience shorter wait times and have more of a likelihood of receiving that funding. And again, I want to emphasize that North Dakota has an advantage in being agile and nimble in order to organize these resources so quickly. The third resource that I want to make people aware of are resources available directly from the North Dakota Department of Commerce and the Bank of North Dakota. We have several options. Option one is an emergency loan through our rural Growth Incentive Fund. I won't go into great detail on the particulars there today, but I want to make people aware of that. Option number 2 is loans for companies certified as the primary sector. I'll make additional details available for that as well. And then finally, we do have a child care loan program that is available. All of these resources are being redirected to support businesses in this time of emergency. So I want to reiterate that the Department of Commerce, along with our other important colleagues, stakeholders, state agencies, and business partners, have worked together over the last week to realign our resources so that we can communicate with you swiftly and easily and make it easy for employers to access the information that they need to know. By tonight or early tomorrow morning, we will have a one-stop web page for employer resources that will provide more information about all of the things that I've discussed today. A press release will be issued when this site is available to the public. And again, I want to mention that we have an employer call tomorrow with the Greater North Dakota Chamber of Commerce. Of course, we can't accommodate every employer in the state. That call will be recorded, and all the information available will be made available online as well. This is a rapidly evolving matter, and I appreciate the dedication and resiliency that I've already witnessed with all of my colleagues here today, as well as across the state and in the business community. We're committed to supporting you during this unprecedented time. Our state is strong, and by working with a unified team, our strength will grow. It is my hope that what we do today and going forward will not only be an example for North Dakota, but for the nation and how a state reacts during a time of uncertainty. Thank you very much.
Thank you. As you can see, we've got some very talented, empowered, and dedicated leaders. This is a handful of the folks that are working from both the public and private sector to try to serve and protect North Dakotans. But know that if we held a press conference an hour from now, we could bring up another 6 leaders. If we held one at 8 o'clock tonight, we'd bring up another 6 leaders because there are so many great people that are working to drive this forward. But I want to thank the presenters for today, and now we'll take questions for myself or for any of the folks that presented today.
Okay, question for Superintendent Basler. Can you talk about, I think that you were sort of implying that right now it's not necessarily legal to offer classes online. Can you talk about the legality of that a bit more?
Absolutely. So no, it's not illegal to offer classes online and online learning. In fact, many of our school districts currently do that, and classrooms currently have flipped classrooms. Instruction occurs online. We have many schools across the state that are one-to-one devices that utilize that technology. What is not authorized in North Dakota Century Code at this point in time is the ability to trade out online learning time for instructional time that is required by Century Code. Formerly, Governor Burgum spoke to this on Sunday night. Formerly, there was a required 175 days of instructional days that was required. 2019 session exchanged the day requirement to hour requirement, and that would be face-to-face instruction that was required by our schools. So currently, there is no allowability in Century Code to allow online learning to replace and be in lieu of. Many of our school districts have been working all week and are augmenting and expanding their online learning opportunities that they used in addition to instructional time to include the offering. So I think it's important to note the difference between offering the students the option of accessing free digital learning experience to students and requiring and mandating that in lieu of face-to-face instructional time.
Governor, we have a question from online from Eric Arndt at KZZY News in Devils Lake is asking, given the new announcement of community spread in North Dakota, when do you plan to provide an update on keeping schools closed longer than this week?
Question coming in from Devils Lake, and we've received feedback yesterday and today that we need to repeat the questions for everyone. I just want to say in a moment of lightness, it's actually easier if everybody watching doesn't know the question that I'm answering, but we will concede and repeat the question for everybody. But the question coming in from station in Devils Lake is, when will we have an announcement on schools? We had said on Sunday night that we would make a decision by end of the week. Technically, that's Saturday. Some might think that's Friday. We're working hard to be able to provide guidance by tomorrow at 4 o'clock about what we would do next week related to the schools. So expect that would be part of tomorrow's conference. I've also been handed another piece of paper that said that earlier today when we talked about the 2 Morton County community spreads, one age 10 to 19, that's correct. The other one I said, and they're both females, that's correct. Both Morton County correct, but the one that I said was in their 20s is actually in their 30s. So correction that one in their 30s and one in their teens. Other questions? Got it in the back? We'll go. You guys fight over who goes first.
This is for Milo and Tucky. You had mentioned that there seems to be a shortage of swabs. Can you tell me how huge the shortage is and how serious it is?
Question for Mylin was mentioned a shortage of swabs, and the question was about how acute that situation is.
Thank you for the question. We have been assessing the supply chain for both the collection devices that are at the healthcare facilities as well as the testing materials that we need at the state lab. The shortage of supplies for testing that collection piece, some facilities have enough for 2 days, some have enough for 2 weeks. So it depends on the location, it depends on the facility, and we're doing everything that we can to help get those collection swabs and the transport media to the providers.
Where do those swabs come from? I mean, are they sent from the CDC here, or how do we get them?
So the question is, where do these swabs come from? I can't say for sure, but they're nylon swabs, which is different than cotton swabs. And just to let you know that these swabs are, I'd say, this long. Dr. Connell is nodding her head. If you've ever had an influenza test where they insert this long nylon swab, you will definitely have remembered that. It's not a pleasant test. We are also evaluating some other ways to test for COVID-19. Our healthcare providers have given us maybe an alternative around a nasal wash, and let me say that that's not a pleasant experience either. So we need you to stay home. We need you to take care of one another and practice that good social distancing.
And just one follow-up there. South Dakota today sort of halted testing because of the lack of supply of some of the chemicals needed for the extraction part of the test, as I understand it. How are we doing in that department?
So the question is, South Dakota halted some of their testing because of a lack of supplies around reagents. That is our understanding as well. We have been in contact with the South Dakota Department of Health and trying to understand what supplies we could share in order to maybe trade for swabs. I don't have a deal on that yet, but it is something that we're talking about looking across the region. For us, we have the capability to do about 1,800 tests within our lab, and we know that our partners, our healthcare partners, also have lab capacity to do tests too.
And again, what Mylin was referring to there relative to South Dakota, because Governor Noem and I have been in contact today, but let's just say they're short of reagents and we're short of swabs, then collaborating across the 2 states, maybe we can help each other out. So that's what Mylin's team and the South Dakota team are checking on. We had another question in the back.
With the Canadian border being shut down for essential travel, have you guys gotten any advice about North Dakota residents potentially in Canada trying to come back or vice versa?
Haven't heard specifically, but I have had individuals reach out to our office about individuals from North Dakota who are overseas and unable to return to the U.S. It was an option for them to fly to Canada and then come across the border. Now that option is closing. We have referred, because this now becomes an immigration issue, which is a federal issue, we have referred people that are contacting our office to contact the federal delegation, so one of the 2 senators' offices or their congressman for help on immigration. But as it is right now, there may be, we know that there are some North Dakotans overseas trying to get home that unfortunately right now are not able to do that.
Governor, you said if you're early, you're on time, yet with community spread now identified, how does that phrase work into your decision to hold business closures to businesses themselves or mayors?
Well, I think it varies this way because Oh, thank you. Repeating the question, you want to say it again? So it was more fun when I didn't have to, and I got to answer my own question, but it's a...
You said if you're early, you're on time. How does that phrase apply to keeping business closures to the decision of businesses and mayors?
Yeah, question was if we're early, we're on time, how does that relate to the decision to ask for personal responsibility and delegate some of this to the local decision? Part of this is because North Dakota is 71,000 square miles. We're the size of all 6 New England states put together. That's Rhode Island, Massachusetts, Connecticut, Maine, New Hampshire, and Vermont. I mean, that's the size of our state. So if you got one bar in Keene or Killdeer, versus that serve primarily local population, might be the only restaurant also in town, and they're being very responsible about social distancing. Their doors are open, people are coming in to pick up food. There's never more than a couple people in there at the same time. You don't need the governor of the state of North Dakota mandating that business close. Now if we got a restaurant that's at a truck stop at the corner of 2 interstates, and we got thousands of people traveling from all over the nation going through there, the owners of that business have got a different decision, and the mayor of that city has got a different decision. So part of where we're trying to enlist here is this concept, which you have to have during a time of emergency, is leadership everywhere. You can't concentrate all the decision-making in one location when local leaders have the ability and they have the information, they can understand their unique situation. So many people are asking us to make the decision. We're asking local leaders at all levels to step up and make the decision that's right for their community based on the guidelines. We're trying to achieve social distancing, and if you can achieve that in a small town that's only got one bar and restaurant, if you can achieve that, then great. If you are got people shoulder to shoulder, and that's your business model, you're not achieving it. You probably need to think about, hey, I should close my business because I'm not doing my part. You're not being a hero, as Dr. Connell said, in terms of choosing the spread. So we're right now at this point asking that local leaders, local business owners step up and figure out a plan on how to do this. Other states have actually gone so far as to say, hey, if your restaurant, can hold, is certified for 100 people, that you can't have more than 50. Or they say, you can stay open, but you got to take tables out so no tables are within 6 feet. But we don't need the government to come up with that idea. If we're asking for individual responsibility, then individual owners could come up with those ideas and achieve the social distancing, but then still have an opportunity to serve their communities, protect their employees, and go. But we said we're going to reevaluate this on a daily basis. If we think it's not happening, we could be walking down the scale like every other state has, and as the wider the spread, the more people end up, the more mandatory the closings are.
If I may, with a follow-up then, with the daily reevaluations, what factors or thresholds are you looking for?
Daily evaluation, what factors or thresholds? Again, testing is one. We've said it every one of these sessions, the testing is latent. It's a latent piece of data. It is one piece of data, but it trails the actual spread. We said earlier in the week that we were closing schools because we thought there was community spread. Now here we are on Wednesday, we've confirmed that. So that's one. The other is actual, how are communities and how are businesses and how are individuals responding? And in a small state like ours, we can get a lot of feedback quickly about whether people are practicing that or not. And then the other thing, from a state standpoint, we're taking some tough decisions at the state level. I understand we're going to be announcing we're closing rest areas, for example, because that's one area where there was potential for a lot of spread. And if we don't have the staff to do, regular, constant cleaning of those places, let's eliminate a place where people could have contact and spread. So, the state's doing its part. We're asking businesses to do theirs.
This is a question probably for the health department. We've been reporting on there's about 80 or so students and chaperones from Bismarck Public Schools involved with the band program that were down in California for a trip, and real recently came back, and they've been advised by the school district to stay at home. We're wondering if they've been in touch with the health department, and what sort of guidance has the health department been giving to them?
So the question was about 80 individuals, students, and chaperones that traveled to California for a band trip and were recently instructed by the Department of Health to stay home. And the question was, what guidance are we giving them? It's the guidance that we're sharing with anyone that has traveled into a hotspot or came back from an international travel area to stay at home, watch for symptoms. B, if you're in a household, probably these students are this way with their parents. The parents have to stay home. That close contact of an individual that has tested positive or we're investigating, we need them to self-isolate.
Has the school district actually been in touch with the health department about those students?
We've been in touch with lots of school districts, and I would imagine, so I can't say who they talk to, but the Department of Health does that contact tracing with our local public health partners, so they're getting guidance.
Governor, this is a difficult economic time for a lot of people, particularly in the oil patch, or people whose jobs are put on hold with business closures here. Have you thought about putting a moratorium on evictions for people that are experiencing those difficulties right now?
Question was, this is a difficult economic time. Given what's going on in the oil patch, given other things that are happening with business closing, and if we thought about putting a moratorium on evictions. My understanding is that earlier today the federal government was providing guidance that people in HUD housing, that there would be a cease and desist on any evictions. I know that as part of our unified command team that we're in contact with all the utilities in the state. We're trying to make sure that if somebody loses their job and they can't pay their phone bill or their heat bill, that we're in a position so that the major telecom companies and all the utilities in the state would make sure that we're providing power and cell service to people during this emergency period of time. And so, yeah, we're certainly taking a look at that. And again, I think that individual apartment owners and business owners are going to have to take a look at their own, review their own policies, because if you're got someone that you're moving out of your apartment, during robust economic times, somebody might rent that. Right now, maybe not. So I think, again, this economic circumstances should cause everybody to review their policies related to this and related to the comments that our Commerce Commissioner, Michelle Comer, and our Economic Times. I mean, this is probably an unprecedented economic challenge for the state that's we may look back and go, look, we handled I hope they look back and say, look, we handled the virus well. We did it with calm, and we did it with a lot of precaution. But the economic challenge is ahead of us at a time when we've got oil prices under $30. We've got depressed ag prices. We had the fall flooding in agriculture. We got challenges in the coal industry. Now, we might have been buoyed in the past by having consumer spending in our service industries. Keep that going. But now you're going to see, challenges there for both employment and revenue for many service industries, non-essential. So it is this is going to be a really challenging economic time for our state and our nation. And I'm, pleased to see that the federal government is looking at record-setting economic stimulus packages because, that helped the nation get through the 08-09 financial crisis, but this one certainly could be much, and they did it after 9/11. There's times when our nation has shown its resilience, but this could be a larger economic impact than either of those two recent events. So a lot of challenges ahead on the economic front.
I've got one other school question, probably for Superintendent Basler. Could you clarify the reasons why there's only, I think you said, 160 sites that can serve meals across the state? What's the reason that the rest of them can't? And then you also referenced HR 6201. If that passes, does that fix this problem essentially?
Thank you. So the question was in reference to our child nutrition program, the fact that only 160 of our school sites would qualify, and if HR 6201 would remedy that problem. So to explain as briefly as possible about why school sites can be identified as food distribution sites. We have approximately 490 school buildings in the state of North Dakota. 160 of those buildings qualify. The criteria set forth by the U.S. Department of Agriculture, the Secretary has the authority. So the criteria set forth is that students within those school buildings, if it is over 50% free and reduced eligible students, that automatically becomes a food distribution site. For summer food programs, those sites are identified, and it's important to note that they can serve all students at that point in time, regardless if they're free or reduced income eligible students or not. So they would serve all students. There are a few other school districts that meet the criteria that are identified using census eligibility areas. So as a whole, that community meets an income eligibility requirement. H.R. 6201 would provide authority to the USDA Secretary to waive that minimum requirement, which would then allow all of our school sites to become food distribution sites that could then serve all of our students. Thank you.
Governor, I have probably a two-part question for you here. Do you have an update on the number of ventilators that are available in the state to treat this particular illness? And then are there trained professionals that can use all of those ventilators if there are?
Two-part question. First one is, do we have an update on the number of ventilators in the state? And the second part is, do we have enough trained professionals? The answer to the first part is yes. And there's actually an infographic map that's up on, I believe, ndresponse.com and health.nd.gov are two websites. It's a geographic map of the state of North Dakota, and it shows where the ventilators are, and I believe it also shows the status of those. Are they portable, not portable? Have they been ordered or not?
So I can say that we have about 13,000 registered nurses. We have 400 certified nurse anesthetists. And when it comes to taking care of, I can speak to this too, when it comes to taking care of a person on a ventilator, being a former critical care nurse, that's very intensive, and the ratio of patients that you could take care of is very small. Sometimes it's one-on-one, sometimes it's 2-to-1. So we quickly max on our workforce, and we're looking for alternatives to get more nurses and other healthcare providers into the setting if we need that.
And just what would some of those alternatives look like, perhaps?
Question is, what do some of those alternatives look like? We're working on, and perhaps we'll have an update by tomorrow, but we're working on one thing. It's supply. It's supply and demand. There's demand all over the country. But we do know that there are people in our state who used to work in respiratory therapy who may have let their license lapse. They got a desk job. Can we contact those working, through associations and others to bring them back into the workforce with some relicensing options? We also know that we've got licensing restrictions by state relative to physicians and nurses of all classifications. For example, if you're licensed only in Minnesota, you may take additional licensing for North Dakota. Could we waive those licensing and go to universal licensing recognition, maintaining the standards of those states around us, but it would give those organizations, particularly ones like we've got, two that come to mind, Sanford and Essentia, that have, cross-border activities. In the case of Essentia, they've got more personnel in Minnesota than they do in North Dakota. Sanford, you got Minnesota, South Dakota, North Dakota, but limiting or eliminating some of those licensing restrictions could help us with the supply of individuals. The other place you could get supply, because a lot of times ventilators are used in a post-surgical situation, so we've got training there. Other states that are further down the curve than we have gone to either recommendation or a mandatory status of no elective surgery, and as soon as you do that, then that frees up ventilators and personnel that might be doing elective surgeries to be able to care for COVID patients. So there's we've got multiple avenues. We're exploring all of them. Question in the back?
For clarification about the border, you had mentioned residents going from across or overseas back into Canada to try and get over. If they're already in Canada and trying to get over, is that considered essential travel or no?
The question was, if an American had made it back to Canada but not yet into the United States, was that considered essential travel to get back home? I don't know the answer to that. I hope it would be, and I would think that Canadians would be happy to let Americans leave their country versus be part of their healthcare system. But it's just a guess. But that's a question I guess our team will take up, and we can ask our federal partners about that question. I mean, the good news for North Dakotans is one of the lowest places of reported cases in America was North Dakota, going into this week. Some of the other lowest reported places happen to also be Manitoba and Saskatchewan. So we were in a good spot on the map in terms of spread heading into this, giving us a little more time to prepare. And I don't know if I don't know if I repeated the question or not, but I hope people like the answer. Okay, one thing which we haven't been asked about, but I want to touch on, so I'll ask the question myself, is what about daycares? We have received questions about that we did a mandatory closing for 5 days of schools, but daycares were left open. We were very thoughtful about how we made that decision. Child care providers are an essential part of community infrastructure, and having those it helps ensure that parents are able to continue working, and that includes essential community workforce, whether those folks work for the fire department, the police department, whether they work in a DD, developmentally disabled setting, whether they work in healthcare broadly, physicians, nursing home staff, first responders. There's so many positions where it's essential that we keep businesses opening. I mean, you might even say, hey, grocery stores is an essential service. I mean, we're working on what the definition of essential service is, but to get through this crisis, we've got to make sure that there's a portion of our supply chains and our economy and our healthcare systems and our basic infrastructure, water, electricity, heat, all those things, telecom, all keep working. And so if one of the ways that we keep everything working is we make sure we've got functioning child care, we wanted again to allow that to be local decision. There's over 1,800 child care providers in North Dakota. Child care in North Dakota, I'm talking about K through 5 or 6 years old. That is delivered by the private sector, not by the public sector in North Dakota. There are federal support programs that help with supplemental payments for people with low income. That only touches about 10% of the 18,000 families that utilize child care in North Dakota. There are close to 45,000 people 45,000 kids that are in child care in North Dakota. That's a different number. That's the 0 to sort of 5 years old. We've got close to 120,000 kids in our K-12 system, but 45,000 in that thing. So this is we made the decision to keep it open, and again, on a case-by-case basis. I'm sure that if a child care facility finds out that they've got someone who's been exposed to COVID or someone who works there, they're going to announce a closure. And so we would expect that as we move through this emergency health situation that we're in, that we could actually see a diminishment of that child care capacity, which has been actually working quite well through this week, through the private sector delivery system. But we were trying to anticipate a time when we may not have as much capacity. And one of the things as part of the planning that we're doing with the K-12 system, because another component of child care would be kids that would normally be in school and might be in a before school or after school program while their parents are working. So essentially that extended day is where the child care is occurring for kids that might be 6 to age 12 when they're below the age when they could be legally home alone. And so we are working with the K-12 system to try to understand and evaluate how could we potentially collaborate with K-12 for providing services for 6 to 12 years old for essential workers. But that planning is still underway. But I just want to say to, and again, the other backup for a lot of parents who work is when the kids are home from school, go stay with grandma and grandpa. And if grandma and grandpa have got an underlying health issue or they're in that age group where they're vulnerable, we've been trying to avoid that. So I just want to say to all the parents out there and all the child care providers and all the kids that are home from college that are taking care of younger siblings, we just say thank you, because anybody that's caring for children, again, should be considered a hero any day. But in this time of tremendous disruption, the people that are stepping up and helping care for our youth who are not at risk of mortality from this highly contagious virus, but they can get it as we learned today, and they can spread it. So again, making sure that we're taking care of those children, but we're also making sure that we got isolation and separation from those that are most vulnerable is going to probably take more care and more people working on it than we've had in the past. So again, we know this is the whole thing. It's economically disruptive. It's disruptive to families. It's disruptive to everybody. But in closing, I guess I would just want to say, one thing about disruption is that disruption is an opportunity for innovation. Disruption is an opportunity for personal change. Disruption is an opportunity for us to rethink things and break old habits. And so, as has been said by other speakers up here, we use the phrase, hey, we're going to come out of this thing stronger than we went into it. I absolutely believe that, but we also have an opportunity to come out of it smarter in terms of how we think about delivery of education, how do we think about delivery of healthcare, how do we think about how do we come together during time of emergency. There's all kinds of ways that we get stronger, but one of the other groups that can actually get stronger coming out of this is families. Families pulling together during this time frame. I mean, come on, North Dakota. This is the time to do it. And if people are worried about education, when I was a kid, we had a 3-day snow day once in the 1960s. Guess what? We had homework. There was nothing online. It was like, you got to, read these books and write a report and you come back. I mean, we talk about technological solutions, but some of the basics we can go back to, as family. And whether that's taking a walk, whether it's reading a book, whether it's writing a book report, whether I said write a letter to somebody that's made a difference in your life, there's things that we can do to support each other, and I say write a letter because it's not visit them in person. You can write a letter and maintain your 6-foot distance. So again, think about the things that you can do that build and strengthen your family and build and strengthen your community at a time that don't require the government to tell you what to do or how to do it. Use your common sense. Take this as an opportunity to start your home workout opportunity. Clean out the garage you've been waiting to clean out. Clean out that closet. This is a chance to do all the things that you didn't think you had time to do. And let's turn this into a great opportunity for us to get stronger. But again, thank you all for being here today, and we'll see you all tomorrow at 4 o'clock. Thank you.